Hello, everybody. My name is Barrister Judith Ene Ameh, and I'm the author of the book Slavery Has a New Name: The Menace of Human Trafficking. I'm here to talk to you about the health implications of human trafficking on the victims of human trafficking. First of all, what is human trafficking? Human trafficking refers to the recruitment, the harboring, and the transportation of people from one place to another for exploitation, forceful prostitution, exploitative labor practices, organ harvesting, child brides, and child armies, amongst others. When I talked about transportation, it doesn't necessarily mean that transportation has to be an ingredient for us to ascertain whether or not human trafficking has occurred. Human trafficking can actually occur within a community or within a particular country. Transportation does not necessarily need to occur for us to ascertain whether or not human trafficking has taken place. Talking about the health implications of human trafficking on victims of human trafficking, we are made to know that these victims often suffer from lack of preventive health care, poor sanitation. They are made to work in haphazard working conditions also. They suffer from emotional and physical attacks, and they lack access to medical care. All these challenges actually makes them prone to illnesses and diseases such as sexually transmitted diseases, HIV and AIDS, infertility caused by the use of unsterilized materials for abortion, unwanted pregnancy, diseases such as tuberculosis, cancer, and diabetes. They suffer from weak eyesight due to working in dim light conditions. They suffer from lots of hearing problems due to noise pollution from the factories that they work in. The question now is, how can this problem be solved? The first step is being able to identify a victim whenever they approach a medical personnel for examination. Now, the following things are what medical personnel should look out for whenever a victim approaches them for a medical examination. First of all, the medical personnel has to be discreet and attentive. They should be able to discern whether the patient is accompanied by a controlling adult or a dangerous looking person. The medical personnel should be able to ask if the patient has any means of identification, and also look out for scars or any form of torture around the body or around the face. While questioning victims of trafficking, it's pertinent to employ confidentiality, to give the patient a break whenever exhaustion is detected. It's pertinent to also believe the victims and do not judge them. Do not blame them. Ask them questions in a rather sensible and sensitive manner. Do not be harsh on the victims. Do not say anything to the victim that may hurt or bruise their self-esteem further. Inform the victims that they have access to all medical health records, and also let them be notified that they have access to medical forensic examinations and reports. After carrying out the required medical health care, to further assist the victims in regaining their freedom, it is pertinent not to carry out any step that will put yourself as a medical professional in danger, or any other step that will put the victim in danger. You can do any of the following. You can put a call through to law enforcement agencies, trusted local law enforcement agencies, non-governmental organizations that are involved in the fight against human trafficking. You can also put a call through to the national agency responsible for the fight against human trafficking, such as NAPTIP, National Agency for the Prohibition of human trafficking in persons. Thank you very much for having me. I'm once again Judith Ameh, the author of Slavery Has a New Name, The Menace of Human Trafficking. Thank you.